A coroner's inquest has been opened to unravel the circumstances surrounding the death of 12-year-old boy Adebola Akinbright with a missing intestine who died at the Lagos State University Teaching Hospital. You're watching Beyond 100 Days, everyone. I'm Nifemi Oguntoye. At the preliminary sitting, the presiding coroner, Obola Folarin Williams, sitting at Magistrate Court 4, Botanical Gardens, Ebutemeta, had opening statements from all the counsels involved with the case. The state counsel from the Lagos Ministry of Justice, Ola Akinde, told the court necessary tests and examinations have been conducted on the corpse and that the post-mortem report is ready. He added that the Office of the Attorney General has received letters from the family's lawyers seeking the release of the corpse for burial and for the corpse to be preserved. Lawyer representing the father of the deceased, Hebun Oluwadegboruwa, senior advocate of Nigeria, also requested to invite the medical director of Obitox Medical Center, where the deceased was first admitted and treated, as well as the doctors that treated him at Lassuth and all policemen involved in that investigation, in order to have a proper understanding of what actually happened to the young boy. Mr. Adegboruwa also applied to the coroner for an independent examination of the corpse so as to avoid the likelihood of bias and conflict of interests. Another counsel, Abiodun Kolawole, appeared as an interested party for the African Women Lawyers Association. After hearing all the counsels, the coroner directed that the autopsy report and all other documents be made available to the parties involved. The coroner also asked all the counsels to harmonize their positions and submit the list of their intended witnesses before the next date. The case has now been adjourned to 24th of November 2023 for further proceedings. Adebola died at Lassuth on September 19 following a plea by his mother to Governor Babajide Sanwo-Olu to probe the disappearance of her son's small intestines, said to have occurred while he was receiving treatment at the state-run facility. But the hospital management denied the allegations. We're following that story very closely and we'll bring you all the updates subsequently. Let's turn our attention now to our conversation today. Did you know that Nigeria accounts for the second highest number of maternal and child deaths globally? According to a WHO report, Africa's most populous nation is only behind India in the ranking. The report noted that in 2020, 788 women and children died per 1,000 in India, and 540 women and children per 1,000 died in Nigeria. In the same year, India accounted for 17% of global maternal and neonatal deaths and stillbirths, while Nigeria accounts for 12%. A maternal death occurred almost every 2 minutes in 2020. Almost 95% of all maternal deaths occurred in low and lower middle income countries in the same year. The big question is, what must the Tinubu administration do differently to improve limited access to quality health care in Nigeria, with UNICEF reporting that the country contributes 10% of the global pregnancy-related death burden. And that's what we're talking about as we explore reproductive and maternal health in Nigeria and what government should do differently. I'm joined on the show by Dr. Bayomi Ajayi, as a consultant obstetrician and gynecologist and the Nordica Fertility Center here in Lagos. Dr. Ajayi, thanks for joining us on the program.
It's my pleasure. Yeah, thanks for having me.
So 1 in 7 global maternal deaths occurs in Nigeria. That's according to the UN. If you put the figures together, we're looking at about 50,000 women dying per year in Nigeria. Why do you think our maternal mortality rate is one of the highest in the world?
Well, I think there are many factors contributing to this, but part of it you mentioned in the intro. If Nigeria continues to dedicate less than 5%, we agreed at the Abuja conference that we'll be putting 50% of our GDP to healthcare. But if you're putting less than 5%, definitely that's one of the things that you will see. And then if we don't put square pegs in square holes, that's what you are going to see. Fortunately, I think we've started well this time. but the people that have, have the pedigree to be able to run the healthcare system in Nigeria. So hopefully, but we still have to back it up, committing money to it.
Interesting, because experts have also said that 95% of these deaths during childbirth are preventable. How do you think we can scale up access to quality sexual and reproductive health services as part of universal health coverage and primary health care?
Yes, well, I think, it's beginning to sound like a broken record, but the truth is that no matter how much we plan, if we don't, the money does not get to where it's supposed to get, then it's not going to happen. So, yes, you know that we've had wonderful plans about primary health care starting from the time of Onikwe and some Kuti, who was an advocate of health for all, and but we saw where we got to. We actually took 1 step forward and 3 steps backward from the time that Onikwe was health minister to now. And of course, we know that there's a lot of factors responsible for that. So we need to have good plans, and then we need also to be able to want to carry out this plan. And yeah, I think the rest will fall into this.
You've talked about budgeting and how we need to also scale up government spending in this regard. I just want us to paint a picture for us, because you have been doing this for decades. How huge is that gap, between quality sexual and reproductive health care and the average Nigerian? What do you think government isn't doing enough to bridge the gap?
Well, I think the facilities, look, doctors are going out of Nigeria. We're losing manpower at a very fast rate. One of the main reasons why they get out of Nigeria is because we don't have the facilities that they can work in and with. And so this is part of the fact, the reason why there can be quality healthcare right now in Nigeria. And of course, there is a big word that affects every aspect of Nigeria. That is called, that's how we see the C word, corruption, until also we are able to backtrack on that and control it, even if we cannot totally wipe it out. Then money that is, even the small money that is allocated should get to the right place where they should get to. And then, of course, we need to also promote competence and be able to put the right pegs, the square pegs and square holes. So I guess it's not rocket science, because Nigeria is blessed with enough manpower resources if it is well managed.
When you talk about brain drain, I'm just wondering, because you are in Nigeria and you have done this business for years. I mentioned to someone, someone had asked me, who's your guest to say? Today, and I said, Dr. Ajayi. He said, you're talking to one of the biggest fertility experts in Nigeria. So how come you did not leave Nigeria? What's chasing your colleagues away?
Oh, no. I guess in the first place, people have always been leaving, but not the way it is right now. You need to make up your mind. As a young doctor, I made up my mind I was never going to leave Nigeria. It's so funny because I'm amongst all my contemporaries in the during when we're training to be gynecologist. I was the only one who decided I was going to, because I always saw that there was a huge opportunity in Nigeria. The sense that while Nigeria is like a virgin, and then you go to a place where you're just a number as it is. So, and that's one of the things that also doctors must be taught how to see the business part of medicine, so that it's not only, we're not just going to be practicing medicine, we also need to see the business part, and that will also make us stay where we are, where they're going to do the business part, and your salary at the end of it, that's taken from them. So, but it's not everybody who does that. So I think that's one of the things I see as the responsibility of doctors also, to start teaching the younger doctors how also see the opportunities that, come on, there are 200 million Nigerians. Well, they're going to, at one point or the other, they're going to be ill, they need their services. So where for God's sake, do you want to go to? That's my own personal. Some people think it's easier. And you know that the way the world is now, we say it's a global village. So talent is attracted to other places where they were remunerated. And so it's not very difficult for them to just take their passports and leave Nigeria. But of course, the truth is that we need doctors in Nigeria. The earlier that the government realizes that and tries to make the ones that have not gone to stay, but ones that have left to come back, then all the ratios will continue to be ugly.
All right, Dr. Ajayi, Wednesday was World Menopause Day, and we were told women can reach menopause as early as 40. That's a big surprise for someone like me. What are the risk factors for women in this regard?
Well, I don't, when we say 40, we're saying that's when you're talking about premature menopause. But women can reach menopause as early as 20. As even, I think one of the earliest recorded is 8. So women can reach menopause earlier, but that's not what probably you would be interested in. Looking at the risk factors, of course, age is the greatest risk factor for menopause. But of course, genetic diseases make women reach menopause earlier. Surgeries can make them either. People talk about ovarian cysts, and you see some people going after they said they've done ovarian surgery a few times. And then some of them, they can be pushed into menopause. Even the fibroid surgery that we do sometimes can push women into surgery, into menopause. So surgery is a known risk factor for pelvic surgery, is a known risk factor for menopause. But of course, the commonest and things like radiotherapy also can make women to reach menopause early, but majority of the women reach menopause because what we call menopause is when the menstrual cycle, this menstrual cycle stops. But we're not always in a hurry to make that diagnosis. We actually always wait for a woman to have reached that menses for 12 months before we say a woman has really reached menopause. So I hope that answers the question.
Well, it does. I want us to explore a little bit about fertility because that's your forte. But we'll take a short break and we'll be back to fix your audio and discuss more on this. Stay with us, everyone. Thanks for staying with us, everyone. Our attention today is turned to reproductive and maternal health in Nigeria following WHO's report on how badly the country is faring and what government needs to do differently. My guest is Dr. Abayomi Ajayi, consultant obstetrician and gynecologist at MD Nordica Fertility Center here in Lagos. Dr. Ajayi, thank you for staying the course on the program. So your fertility center, I understand, pioneered the IMSI. It's a mouthful, intracytoplasmic morphologically selected injection in Nigeria. I just want you to walk us through how, in vitro fertilization and treatment of infertility have evolved over the years in the country.
Yeah, thank you so very much. Yes, I think we've been doing this for about 20 years now, and so to answer the question, I think we've had
well, it seems we're having difficulties connecting with the doctor. We're going to hopefully work on that and continue with our conversation. According to, okay, Dr. Ajayi, can you hear me now?
Yes, I can.
Yeah, we lost connection with you for a minute. Please go ahead.
Yes, I said, yes, the IVF business or sector has grown tremendously in the last couple of years in Nigeria. I mean, starting with where we had only 2-3 clinics in the whole country, we have over 100 clinics now in Nigeria, and it's still growing. So I think a lot of players are into it now, and the populace also are much more aware of IVF than what it used to be in times past.
On one hand, we are thinking, the country is concerned about population explosion, but also there are people who are in great need of this service. Talk to us about the affordability. Is it something the average Nigerian can access?
Well, I guess it is. Depends on who this average Nigerian is. Most of the time, especially now, so with the exchange rate of the dollar, it made it very, very, very difficult for both the players and the people who access IVF now, because most of the things we use are imported, and because this is technology limit. And therefore, most of the things that you buy, you have to buy for an exchange, and that's made it very, very difficult for everybody. But the truth of the matter is that this is a service that is very necessary in the country. Yes, you said we're trying to control population, but you know what they say: it's who wears the shoes, who knows where it pinches. And so people who are faced with infertility really know it's one of the most difficult things that couples can face when they're trying to have their own children and they're not coming. And you see that a lot of people will spend their savings on this. But what we're trying to do in a country like Nigeria is to make sure that you get the value for the money you spend by trying to regulate, to make sure that anytime you're doing IVF, you're having the standard that you should have or you could have anywhere.
So when people say they tried it and it didn't work, is it a function of how the service was rendered, or there's still some amount of chance needed for this success rate?
Of course, anywhere in the world, IVF is not 100%. Even in the UK, baby take-home rate is about 19-20%. So people need to understand how the technology works sometimes. And this also starts from even how you make decisions. Okay, when you are 45 years old and you come to me and you say you want to lose your eggs, I mean, come on, that's no longer physiological. It's not that you cannot have a baby, but the chances are probably less than 5% using your eggs. So these are some of the things that we need to look at: how to make decisions, how to understand what the technology can deliver and what expected to fly, except in cinemas. So that's one of the things that people need to understand. What are the shortcomings of this technology? What can it really deliver? And then so that you can expect you can know what to expect from it.
What options are here? What options are available here for government intervention when we discuss affordability? Is there a sense to which government can subsidize this service for Nigerians who need them?
I really doubt, except health insurance system. Okay, that's probably the only way that government can be helping it. Because what I say most of the time is that for us to even look at high-falutin things like fertility or fertility treatment, we must have solved the problem of communicable diseases in the country. So if we cannot even afford to treat malaria for free for the populace, we can't treat tuberculosis, and it's going to be a pipe dream for us to be thinking of making government to subsidize to give free IVF treatment. So, but if we have a health insurance, then it probably will increase the spread of the people who can afford it.
So the issue of awareness of sexual and reproductive health and rights is said to be very low in this part of the world. How can stakeholders contribute to this awareness?
Yes, I think a lot has to also do with this kind of thing that we're doing now. What I say to people is that the mass media gets to thousands of people at once. And so that's why they're very important stakeholders in raising awareness on this all these factors in Nigeria. So we need to also see how we can bring you guys into understanding what IVF or reproductive health is all about, and also giving the forum to practitioners to be able to hear their views on some of these comments. You see that sometimes it's the people who are alarmists who are seen more on TV. There was suddenly there was something about egg trading and all that kind of thing going on recently. And I saw a lot of things that didn't just make sense at all. And people were all about this. And you know that anytime we're talking about reproductive health, there's a lot of emotions involved. And we respect that, but I think it's also good that we hear the balance side of things.
We have to go now, Dr. Ajayi, but I'm sure you're following the diphtheria outbreak and the increasing number of mortality, particularly among children. Government says there's poor vaccination amongst children. You deal a lot with children. What do you think is the problem? Is this a carryover from the COVID-19 incidents?
Well, you answered it, is vaccination. Fortunately, diphtheria is one of the things that vaccines can take care of. So I think the vaccination is something we just need to. Don't forget that also there was a time that people were all over the place with false news about vaccination. And I think we really need to sift out the news that we get and be able to sift out the wheat from the chaff. And please, we need to continue to listen to the specialists, people who know about this, not people who just think they have an idea. Because this is one of the carryover of such things now, that people are dying needlessly.
Consultant obstetrician and gynecologist and the Nordica Facility Center, Lagos, Dr. Abayomi Ajayi. The next time we're going to be talking, perhaps I would advise that you come into the studio so that we can have a better conversation and understanding of this matters. Thank you so much for talking to us on Beyond 100 Days.
My pleasure. My pleasure. It's so.
And that's our program today. You can watch it again at midnight and at 6 a.m. tomorrow. Do have a lovely weekend. Well, I'm still here for the news at 7. Stay with us.